The femoral triangle is a subfascial space in the antero-superior thigh. It is bounded superiorly by the inguinal ligament, medially by the adductor longus, laterally by the sartorius. The floor, laterally, is the iliopsoas muscle, and medially the pectineus. The roof is the cribriform fascia. Contents of the femoral triangle from lateral to medial are the femoral nerve, artery, vein, and empty space with the deep femoral lymph nodes. That can be remembered as navel. The femoral sheath is a continuation of the transversalis fascia, seen here, and the iliopsoas fascia, seen here. The femoral sheath does not enclose the femoral nerve. It does, however, enclose the femoral artery, vein, and lymphatic system. The femoral sheath allows for the femoral artery and vein to glide deep to the inguinal ligament during movement of the hip joint. The femoral sheath is subdivided into 3 compartments. The lateral compartment houses the femoral artery, intermediate compartment houses the femoral vein, and the medial compartment houses the femoral canal, the empty space with the lymphatics. The medial compartment is the smallest of the 3. It allows for expansion of the femoral vein when venous return increases. This is the site of femoral hernias. We can see the same thing here. We have the lateral compartment, the intermediate compartment, and the medial compartment, and here we have our femoral hernia. Let's take a look at the venous drainage of the lower extremity. It can be divided into superficial drainage, outlined here in light blue, and deep drainage, outlined here in dark blue. The great saphenous vein, seen here medially, drains the superficial dorsal foot as well as the medial superficial compartment of the leg, and it drains into the femoral vein here. The lateral superficial compartment of the leg is drained by the small saphenous vein, seen here. We can also see the small saphenous vein here posteriorly. We can see that it drains into the popliteal vein, which is a continuation of the femoral vein after it exits the adductor hiatus. The deep venous drainage of the leg is as follows. The deep dorsum of the foot is drained by the anterior tibial vein. We can see the anterior tibial vein here posteriorly as it drains into the popliteal vein. The plantar foot is drained by the posterior tibial vein, which is a continuation of the popliteal vein. The deep lateral compartment is drained by the fibular vein, which drains into the posterior tibial vein. Again, the posterior tibial vein is a continuation of the popliteal, which is a continuation of the femoral vein. We can see the femoral vein here anteriorly as it meets up with the great saphenous vein, goes under the inguinal canal, and becomes the external iliac